All right, good afternoon, folks. And it is a beautiful good afternoon, and welcome to the Marketplace Show Reset and Jumpstart. I'm Anthony Weeks, and I'm joined by my colleague, both Linda Dorman and Carolyn
Good
Howell.
morning.
And
Good morning.
how are you? What's going on?
We
How
are
you doing?
staying busy. We are staying busy this beautiful afternoon. We're waiting for more beautiful rain to make more of our cherry blossoms are at peak. Linda,
They
can tell us.
are. I had a chance to go down, take some pictures with my daughters, really get out, enjoy the sun. And I think part of that confidence was getting my first vaccine. So we encourage individuals to make sure they participate in the vaccine programs. You're eligible and in good health, according to your doctor, to be able to do that. So that's what's going on. We're just being COVID responsible. It doesn't stop.
Yeah, well, mentioning COVID. Oh, by the way, just for housekeeping purpose, folks that are tuning in now, this is the first segment, health and wellness. This is not the actual case press conference that starts at 1:30. So please, you're more than happy to stay, obviously, for the first segment on health and wellness. But this is not the press conference for the case launch announcement, and that starts at 1:30. So look forward to having you join us as well. Ladies, speaking of COVID, I don't know what's going on, but the numbers on the rise again.
You know what's going on, and I think we all do, Anthony. As a matter of fact, a little over a week ago, Maryland, our state, was identified as one of the new hotspots. People have started to relax what they're doing. Some people, they're just taking too many chances, it appears.
But is it because the people who got vaccinated figured they got the S on their chest and feel they can go out and don't need to do the social distance and stuff? Or is it the people that haven't been vaccinated figuring that people are getting vaccinated, so therefore somehow you have this weird balance or trade-off of herd immunity? Which
Well, I read two separate articles, and the first one said that obviously, at least for our state, those that are 65 and older have largely been vaccinated. And as a result, they're being careful because they were careful enough to get the vaccines. But it says that there's a real relaxing. This is spring break time for many, it was 2 weeks ago as well as now. Even on our state at spring break, and people are just, the warm weather is bringing them out, and people are thinking, how can it be COVID? How can people be dying? It's so beautiful. It's so warm.
Yeah. And
really?
there is a confidence. I just shared with you, I had my vaccine. I had confidence to at least go and enjoy the cherry blossoms here in the Washington, D.C. area, down in the Tidal Basin, but I didn't see any social distancing. We worked very hard to remain socially distant. It was difficult, but you did see, by and large, the majority of the people, it was a rarity to see someone without at least a mask, and then some who went so far as to put a shield on. The reality is this: the numbers are going up for a variety of reasons, because also we have the variants. Dr. Fauci has discussed this on Capitol Hill. He's testified as a result. We've had a lot of controversy in those hearings regarding the continuation of a mask use and just the social distancing if you haven't been protected. And we still have those who are weary of getting the vaccine. I mean, I would probably have to honestly say, before our show and our guest that took us through the process of the technology for both Carolyn and I, Carolyn bungee jumped all the way, and I was right behind her. So she gave me the extra confidence and boost, and I'm so happy about it. I'm having zero reaction except for a sore arm, as if I had lifted weights. I did have a slight headache yesterday, and I'm waiting for the fatigue just so I can have an excuse not to do housework. So that hasn't come yet.
And Linda, to your point, that's a really good thing, because and Anthony, we talked about this in the fall. You said, if a vaccine comes out, would I take it? And my answer was absolutely not.
Right.
They're not going to, make me a guinea pig. And then after we had our show with Dr. Angela Marshall on, and she explained it, and the best way I can explain it is, if you consider Pillsbury, they've been making cake mix batter for about 50 years. If they want to make it chocolate, then they add things in it to make it chocolate. They want to make it strawberry, they do that. They want to make it lemon, they do that. So when we got this vaccine is a proven base formula that has been accepted and used for decades, and they simply had to add a code to it that would identify and trigger your body to create certain antibodies. When I heard that literally after the show, I did everything I could, registered to get the shot, and I got it, my first shot. So now I'm 2 weeks after my second shot. So I'm considered completely protected at this point. But I still wear a mask, and I still social distance, and I still use sanitizer.
Good for you. Well, but real quickly before we bring on our guests, the other thing is, I think people need to understand the efficacy of, it depends on which vaccine you're taking, ranges anywhere between 65% up to 95%. The efficacy basically says it reduces your chance of getting it, but most important, it reduces the potency, the effectiveness of the symptoms that you can experience, where it's not deadly. It reduces the severity of it, but it doesn't guarantee, the vaccine doesn't guarantee that you will not catch a COVID-19.
That's correct.
But it helps you to manage the symptoms a lot better. So people need to be very careful in terms of how they're looking at this whole vaccine thing,
That's correct, Anthony. I'm glad you made that distinction, because we have had phenomenal conversations, Dr. Angela. That entire segment was on dispelling or removing all the misinformation or disinformation that takes us down a slippery slope of Dr. Google. So you know who Dr. Google is, right? Dr.
No.
Google has been my best friend, and my provider.
Okay. Oh my God, you got me in that one. Yes, Dr. Google.
Yeah,
yes,
so we can't rely on Dr. Google. We have to go to the true practitioners.
Yes,
I'm surprised you didn't know who Dr. Google is. So we encourage.
I was a little bit distracted. So that's
we understand. This is a big day, and we're excited for that. This is a very big day announcement coming forward. And
I've been jamming to Justin Timberlake, "Can't Stop This Feeling" all week.
Wow, that's nice. You should have played that as background music.
I just want you to know that, all right? Can't stop the feeling.
Oh my goodness, Carolyn, we're seeing like
we're normally not seeing you this chipper. We're normally
Anthony is unleashed in this segment, and we are so glad to be the first up, because we love the virgin unleashing of what's going to come after today. But this is a really good conversation, and we're so excited to have our guests return to finish out a very content-rich conversation that there was no way to get it into an hour. We remember the days where we used to be only a half-hour segment. We appreciate the listening audience and the viewing audience giving some feedback that we got the opportunity to expand to a full hour. And now we have guests that are just taking it from top of the hour to the end of the hour with juicy information that we appreciate. And and then some.
So who is the suspense? Who's the guest?
Okay. So
I'm sure the audience wants to know who the guest is.
Well, we brought back Deborah Stallings. If you remember, she is the HR professional coming to us out of Maryland. This woman has really a global company, but she is really, really strong in the nation. And what we wanted to talk to her about is the human resource. Now that everybody is opening up and going back, what are the implications that COVID has now brought to the workplace? So we asked, we had about 20 questions for her. We could only get 7 or 8 in the first time. Like, if my employer makes me go back to work, do I have to, and what are their responsibilities? So we want to pick up that discussion today and find out what are our rights, what should be our concerns. So we're ready to bring back in this HR professional, this human resource for us. Hi, Deborah.
Hello. Hi, everybody.
Hey, Deborah. How are you? Welcome back.
Good, Anthony and Carolyn and Linda.
I'm reaching over to get my notebook.
Happy Wellness Wednesday.
Oh, thank you. Happy Wednesday to you all as well. And thank you for having me back on the Reset and the Marketplace show. It's a delight to be with you today.
Isn't it amazing that we're at the end of the month already, which means we're also at the end of the quarter. And today was the first deadline for the ending of PPP applications, but that have been extended. So please, everyone, we have to get a plug in for that, for the small business, particularly the independent contractors. Please go on jumpstarteconomy.us and fill out all of your online paperwork to get your to qualify for PPP, because we know that you need it.
Especially.
Absolutely. And don't forget, you go to, against the customized URL is www.applyppp.info. www.applyppp.info.
And we
Absolutely.
really want to, oh, I'm sorry for cutting you off, Linda. The last time we talked about this during the forum. This is a gig economy. So some people who are just DJs never thought that they would qualify for something like that. We want to reach out to any of those individuals who had viable businesses that were in existence prior to February of 2020 and say, listen, at least go on and apply. It's going to let you know up front whether to move forward with the application because you do qualify, or it'll stop you short. But don't miss an opportunity because you didn't even check.
All right. Thank you so much. Ladies, I'm going to go backstage so you guys can do your thing. All right. So I can continue producing. All right. I'm looking forward to the conversation.
Wonderful.
Outstanding. Thanks, Anthony.
See you later.
So, Deborah, we have our question list in front of us. And so we're thankful that you were able to answer so many of the questions last time. You helped us understand the new policies that were developed and how companies were preparing for the return to work and what would help job candidates, what they could look for if they were trying to secure a job, and even around the subject of mental health. But we want to pick up sort of where we left off last time and ask you this question. And it actually winds up being question 10 that was on our that we had sent you. What lawsuits have been brought that you're aware of against employers, and why?
Okay. All right. So so there's a national law firm by the name of Fisher, by the name of Fisher Phillips. And they have reported that there's more than 1,600 lawsuits associated with COVID-19 since March of last year. The largest cases are coming out of California and New Jersey, Florida, and New York, Ohio, and Tennessee. And the industries that are being hardest hit by these claims are the healthcare industry. They've seen more than almost 350 lawsuits. Federal and state government agencies, 121 lawsuits. Hospitality, 105 lawsuits. Manufacturing, 138. Construction, 81. Education, 66. Finance and insurance, 68. And the list goes on. And the kind of cases that employees are filing against their employers include remote work, conflicts, where they might be being required to come back to work or being told that they have to take a vaccine to come back to work. So these are all considerations that employers want to give some thought and attention to. There are also claims of employment discrimination. That's a big one. The remote work issue, 434 claims, lawsuits have been filed around remote work. And employment discrimination, 381. Retaliation and whistleblowers, 361. Wage and hour, 109 claims. Unsafe workplace, 84 cases. Wrongful discharge, 63 cases. And negligent or wrongful death, 46 cases. So it's a really big deal, and employers really want to give some careful attention to how they're handling various issues as it relates to COVID.
It's really across the board that these lawsuits are so prevalent in so many sectors and touching so many different employer workplace scenarios. I would have expected, frankly, that healthcare would be a big one, but you had mentioned 361 for which industry? Because that kind of blew me out the water.
Retaliation and whistleblowing.
Retaliation and whistleblowing. Can you share a little bit more detail around that? Because that just completely eclipsed the 84 cases related to which one was that again? Because I wrote that down. The 80
unsafe workplace.
Unsafe work. You would think that it would be the other way around.
Yeah. So
that those kinds of lawsuits that speak to safety or mandates that were very uncomfortable would be the larger number, the more voluminous number, versus a retaliation. I'm not sure I get that. I understand what it means, but in the context of COVID, can you share that for our viewers and listeners?
Yeah. So for example, whistleblowing is where someone reports that they feel they've been, that they feel something is going on in the organization that is discriminatory, or it could be some other issue. For example, OSHA has implemented new legislation and since President Biden has been in office. And one of the aspects of that new legislation is that employers and employees can do hazard assessments, and if they don't do it, employees can report that. That's an example of whistleblowing. So if an employee reports something that creates an issue for the employer, and then they retaliate against the employee, that's a potential issue. So a lot of times when employees file discrimination claims, they don't often win those, but retaliation, there's a higher percentage of win rate on cases associated with retaliation, because employers or employees or coworkers get upset that the employee has filed a claim against the employer or reported an incident, and so maybe they're not getting invited to meetings anymore, or maybe they don't get to engage in certain activities the way that they used to, or maybe they were qualified for a position where they did not get promoted get that opportunity, and so they file claims of retaliation because they believe, well, I was qualified for the position, and under other circumstances I believe I would have gotten the position, but I'm not getting the position because they're upset with me that I was a whistleblower and I reported this incident.
Wow. That really says a lot, because obviously discrimination is something that we're always concerned about. But in this, and I don't want to say that we're paranoid as a result of COVID, but we've been made so aware of safety things to do, about when you wear a mask, where to wear it on your face, how to disinfect. So if I were in a workplace and I saw that maybe something was not being cleaned properly, or they weren't managing persons that had COVID, I think that I would be one to quickly bring that to someone's attention. So that it almost works against itself, if you will, if I'm making myself clear. It's a scary thing, and there are real repercussions if you don't report this. It doesn't just affect a single individual, but if you do and you get retaliated against, then was it worth losing maybe your job, your position, or your rank, if you will?
Mm-hmm. And it's quite daunting, because this is new territory. We understand that retaliation, discrimination suits. That's why we have EEOC Commission. We have the bodies and we have the case studies. The precedence is set for things that we're familiar with. COVID, across the board, across industries, and the impact, I would think, would be a door open to really examining how to help companies comply and build safer, more employee-centric work environments versus profit centers. And we know that they coexist. What are we seeing now coming out to support employers dealing with these COVID-related lawsuits? And I'm assuming that most of these, as we're talking about, are COVID-related in some form or fashion.
Mm-hmm. So, I don't know that we're seeing any decisions that have been made on these claims yet. Sometimes it takes, years for these issues to get resolved, because if, for example, if it's in the federal government, there's a process that employees need to go through first to file the claim. So they have to file the claim through the government's formal EEO, informal and/or formal EEO claims process, and go through that process first. And so there's about a 6-month period of time that, you know, they're conducting the investigation, right? So once the investigation is conducted, there's a finding. If there's no finding against the employee might still be given a right to sue letter. And so from there, the employee is going to an attorney to file a formal lawsuit against the employer. And so then the process starts from there, and that can take years. So we're not necessarily seeing the outcomes yet in terms of what's happening with these cases. But the fact that they're being filed, that it consumes a lot of administrative time, a lot of management time, a lot of research, and a lot of, you know, discomfort and dissension in the workplace. So the more that an employer can do to mitigate and prevent and reduce these kinds of issues, it's in their best interest to do so.
Wow. So let me ask you this. Does an employee have the right to refuse in-person work without being fired? Has that been discussed?
Yes, and the answer to that is perhaps yes. They might have a right to refuse to work. It depends. So, for example, you know, in our last time that we met and talked, I talked about, you know, the fact that there are various laws and rules and regulations that employers have to abide by to ensure that they're on the right side of the line on things. So, for example, if an employer requires, you know, that it's mandatory that employees come back to work, or that they all wear a mask, but let's say an employee has a pre-existing condition where wearing a mask for 8 hours, you know, would create medical issues for that employee. And so, therefore, the employer has to be careful and go through an interactive process with the employee to understand what is going on with them, and, you know, why they feel they can't wear the mask, that sort of thing, and then make a determination in terms of how best to treat that particular situation. And however they treat that situation can impact what happens with other employees, because you cannot show disparate treatment, and you can't have disparate impact against other employees. So, you know, what I advise employers to do is to be sure that you're talking with your legal counsel, with your HR person. You know, it's a team collaborative action that needs to happen to ensure, or to best ensure, that you're, you know, not going to be facing some kind of claim of discrimination or wrongful discharge, that sort of thing, because some employers have terminated employees because, you know, they refuse to wear a mask, and hence why you see some of the lawsuits. You know, the healthcare industry, you're seeing, you know, some of the lawsuits too, because people are saying, well, I was exposed to, you know, COVID at work, and there was not proper personal protective equipment for me to wear, and that sort of thing. So most states have legislation on the books that, you know, say you can't, you know, when it's a pandemic, there are greater protections for employers against employees filing complaints.
Oh.
However, if an employee can show that their employer was negligent in some way, then those laws won't necessarily protect the employer.
And frankly, I'm glad to hear that, because employers, I'm not sure they entered into the year 2020 with the concept and understanding that, and literally within that, towards the end of the first quarter, maybe even somewhat mid-March, so a year ago, that they would begin to have stay home or shut down orders. You know, communities, we were in a quarantine, a stay home quarantine, and have a need to continue a base of operations for those who could. Obviously, restaurants and physician offices and dentists and all kind of organizations and businesses were trying to scramble to determine, am I an essential business according to my state mandate, and therefore could continue to operate at a certain level. That these businesses and others would frankly have a measure of protection, that there would be some arm's length around this new thing that did occur, that was very historic, and we have yet to see that in this. I don't know how many businesses are up and running that were 100 years old with the same, owners and teams of people, but suffice to say, there should have been some learning and some relaxation. I do agree that if it was gross negligence, because there's a degree of understanding and learning curve that businesses had to come up. And we've had, our business, Orange Wall Enterprises, we first talked about the scanners, the temperature scanners, and having human scanners to stand at the entrance, only to know that that is an extreme liability, we believe, because you're exposing that 24-hour or that 8-hour or 16-hour worker to your entering public into that facility on an ongoing basis. So we were very proud to bring a product in the Orange Thermal Control to the market and be able to say, here is an autonomous temperature scanning station with all of the bells and whistle technology and data management for contact tracing that an employer could use with a return on their investment in just mere weeks, and no liability issue or potential liability issue. So it's those types of things that people had to really pivot and come across opportunities to bring to the market, these new policies, procedures, strategies. And I think employees need to really think through, was it a relaxation of their business, or was it a matter of needing to learn how to better serve their workforce?
Yeah.
That's a good point.
So it's really important that employers look at the various laws, rules, and regulations that impact these kinds of issues, especially around COVID-19. So you want to be familiar with EEOC regulations. You want to be familiar with the U.S. Department of Labor regulations, OSHA regulations, the National Labor Relations Board, etc. And I know busy business owners don't necessarily have time or the capacity to focus on that, which is why, I'm suggesting that you call on your HR folks and your legal folks to give you insight and feedback on that. Of course, HR people have a good amount of information and background that can really save time and money as it relates to, providing insight around this. But that's really, really important that you know what all of the laws, rules, and regulations are, all of your policies that can be impacted, and really think this out ahead of time. I was talking with a group of people last night for a presentation that I was a part of, and there was an international speaker, that is with the large real estate industry where they're doing billion-dollar projects and that sort of thing. And we were having a conversation around this, and his forecast was that employers are going to, he believes that most employers are going to bring people back to work, especially the larger employers, because they're finding that the productivity in the remote work setting is not what they'd like it to be in those large organizations. And so we were having a conversation around, well, how are they going to make it happen, and what's going to be the process, and just kind of brainstorming around that, given these issues that we're talking about today.
So Deborah, I'm glad you mentioned that, and we're going to really focus on that just as we are finishing up our segment. But so many companies, so many businesses have been working hard simply, and I'll let you answer this. We're at the top of the hour. I can see Anthony and tell that. But a company like yours, we'll get to that later, because Businesses are just trying to stay in business, to survive, to thrive, to recover, to be resilient. So they're going to need a one-stop resource. And we're going to talk more about HR anew, but we'll cover our next question after Anthony takes us through our top of the hour rundown.
Fantastic.
The reopening measures are slowly taking place amid the coronavirus pandemic. Malls and restaurants are working again, and factories move more and more of their personnel back into the offices. However, that doesn't mean that people won't get sick anymore. On the contrary, there are now many more chances of spreading the virus even farther. To protect the employees and clients of your business, we developed Thermo control screening stations. It is a quick and safe solution. Thermo control measures temperature at a distance of 25 centimeters. The device is autonomous. It does not require an additional employee to conduct temperature measurements or log the results. It can measure and even recognize masked faces. All of the results are logged automatically and stored in the database. You can use the station to ensure your clients and employees access to your building automatically.
John Smith Brombat.
The station can issue entrance passes and grant access to the building after it measured the person's temperature. If the visitor's temperature is high, a notification will be sent and a potential carrier of the virus can't access the building. Thermo Control can send SMS and messenger notifications, as well as notifications over email. Temperature measurement technologies allow businesses to ensure the safety of people and potentially save lives all over the world.
If you're a small local business and you have not yet applied for your PPP forgiveness loan, you should know the deadline is fast approaching, and you need to apply now before May 31st, 2021. To apply now, go to www.applyppp.info. If you're a small local business and
I just love the sound of that. So Deborah, let's get to a few more of our questions, and we're going to wind up with a vibrant discussion regarding HR anew and what you all are doing in that space. But let me ask you this question. If a fellow employee becomes sick with COVID, is the employer required to withhold that employee's name?
Probably. I would venture to say yes because of HIPAA laws, that they probably should withhold the employee's name. However, they do have actions that they need to take. For example, the employee becomes sick at work, or they come to work sick. They use the Thermo machine, and you discover that they, have a temperature and that they are sick. They should be separated immediately from their coworkers. And employees should be notified that someone in the organization or the company is positive or sick, and so they should get tested. They should be encouraged to get tested. The employer can't require it, but the employer could require that they quarantine for a certain number of days if they've been exposed to that employee in some way.
Wow.
Interesting, because and I know of situations out here where there's just really no definitive policies that one can turn to, so they're making this up. And I don't want to say making it up kind of willy-nilly. I mean, they're needing to really look at and create new policies around specifically these kind of dynamics. And are we finding that there is something related that's more standardized that individuals can in fact somehow go to some database and repository?
Yeah, so what we've done at HR New is we've, done research looking at CDC guidelines and requirements, as well as the Society for Human Resource Management, as well as other regulatory organizations like OSHA, labor. We put together a system for employers, from health questionnaires to PPP, PPE equipment, et cetera, and what employees will need to do to be protected at work and to protect their colleagues and their coworkers as well. And so some good resources if for those that want to do it themselves, certainly looking at CDC, there are plenty of videos, there are plenty of posters and resources that you can download or watch that give you insight. But at the end of the day, after you review all of the research that's out there, then it's a matter of putting together your strategy and your plan for your company that is going to, do the best job that you can to protect your workers and protect yourself from coming in contact with COVID-19, keeping everybody healthy, and also minimizing the potential for liability against the company.
Wow. That is a whole boatload of work to do on top of what it is a company may do that, maybe they produce something, maybe they're a restaurant. This is a whole line of work that they now need to check out that they never had to be concerned with before. So to that point, as it relates to, we hear all of these things about sanitizing and cleaning. Once someone has been confirmed that they have indeed had a reported case of COVID, some employer, perhaps in an office building, are there laws that even govern the way cleaning needs to take place? Because we really have heard horror stories.
Mm-hmm.
We sure have.
Mm-hmm. So there are guidelines, not necessarily laws, in terms of what needs to happen. In many cases, employers just shut the office down, send everybody home, have everything sanitized, bring in companies that do the special cleaning for COVID. So you want to ensure, that the organization is clean, that employees are sent home. You might want to have employees self-quarantine for some period of time if you feel like the whole office was exposed. I have one client that I can think of that what they do is they don't allow the cleaning company to clean their offices. They clean them themselves. And they also manage how many people come to their office. So, no more than a couple of people, for example, can be in their suite on a given day. And so then they sanitize their space. They stay in their offices or their workplaces. I said to them, do you take your mask off? And they do. And I said, well, as far as I'm concerned, that's still not necessarily a safe environment. So, you can give, clients, you can make suggestions in terms of things that are going to help create the safest environment possible. But that doesn't mean that folks are going to follow what you're saying, because people do what, we're just living in a world today that everybody does what seems right to them, and not necessarily. And unless there's a law, even if there's a law sometimes mandated, that, as we could see, people didn't necessarily follow, the law or the expectations to the letter. So it's just a time in the world where I think, I just encourage us all to do better, to really work together and understand we're all in this thing together. And, I need to protect you and, do the best I can to help protect you and me, and you do the same. And if we can do that, we're probably going to come out of it okay. But if we're all doing different things, we can't get a handle on this virus the way that, we probably could if we were working more collaboratively together.
And wouldn't you say, sadly, that we have already, what you just said is really our cultural um, take on things right now, that we have had, by and large, a lot of dissension around the mandates that are just common sense.
Mm-hmm.
We've had a lot of challenges just in some of the more rudimentary or elementary things that we think are going to help stop the spread or slow the spread or keep us protected. I think of just the visceral conversations around, we have heard in the media around the wearing of masks. We
Right.
understand individuals who have different health issues. I have a family member that feels claustrophobic to wear a mask and a shield. And I feel like that's not a problem. Just
Mm-hmm.
slap it on my head and my face, and I'm on my way out to the grocery store and never gave it a moment's thought.
Mm-hmm.
So there are those individuals who have those, and this is a person that travels on airplanes quite frequently.
Mm-hmm.
So it's an interesting dynamic in studying to the human psychology around what we're experiencing as a result of this COVID to create the types of products or the new approaches to their therapies that are going to have mental health issues, and new programs that will certainly address these issues, not just isolation, but really the why are these things so problematic for you? What is there in your conscious mind that would make you feel that this is an inappropriate approach, when there are other countries that we can actually look to and model off of that have done exceptionally well, because they are much more harmonious around certain government issue mandates. I don't know if it's our mistrust of government. I don't know what it is. We can go into the politic of it. But I do know this. We have close to 600,000 lives lost in this country, millions of cases, and now we are working really hard towards building the kind of trust that we need to go into the communities of color in particular with the COVID shot. We don't know what the future will hold. We don't even know if we're going to need this COVID shot every single year, or maybe even later this year with the variants that come out. We don't know those things, but we are part of the living history in this part of our, global history of humanity, that have to bear the responsibility of some of this unknown, yet still go forward into those corridors of what is now unknown.
Yeah.
Wow. So
Absolutely.
that's very well said, Linda, really. And so to that point, Deborah, what are the best practices? What has 2020 taught us? And has it really rewritten the employee handbook? I mean, you're on the front line seeing this, and I think your company, HR Anew, is an incredible resource. So what are some of those best practices? What should we as employers, Linda and I are employers, and we have been employees, and we're entrepreneurs. What should we be doing? What should we all be doing?
So the first thing I would say is get educated about the COVID-19 and the variants that are out there, and understand the CDC guidelines and other regulatory agency guidelines. Understand that the policies and procedures that you have in place from before may or may not work now. So you want to look at your policies and procedures, your business continuity plans, and ensure that those are nice and tight. Bring HR to the table to be a part of the conversation, because in many organizations, HR is viewed as a functional department and not necessarily as an asset to the business. And HR has the HR professional, good HR professionals have a lot of insight and knowledge, and they know where to go and get the information to bring to leadership, to bring to business owners and CEOs, and help you navigate and think through, what are the risks, and what risk are you willing to take as leaders and as business owners. And then ensure that you have a good system for how you're going to handle employees that, come into the workplace or go into a client's workplace to work? How are you going to handle personal protective equipment? So we have employees, for example, that work at government agencies. So it's a collaborative effort. Even though the employee is still ours, they're at risk in the employer's environment, right? So we want to know what the employer has in place for PPE, or do we need to provide our employees with PPE so that they can be protected? These are best practices. Ensuring that you have the resources, the PPE kits on site for your employees that are coming back to work. Deciding if you're going to make the vaccine mandatory or not. Providing education to your employees about vaccines. You all were talking about having Dr. Angela Marshall on. This weekend we have Dr. Barbara Hutchinson that's going to be doing a complimentary webinar on Zoom about the vaccines, and so that the general public, we want to get, our minorities and women and underserved communities educated about the vaccines and their options, so that they are better informed and feel more comfortable with getting a vaccine if that's what they decide to do. So these are some best practices that will help us get further down the road on this issue, further down the path, because we're still learning, and there's still so many unknowns. But based on what we know right now, today, these are things that I believe we could do to help safeguard us to the best of our ability. We also want to talk with our insurance companies, your workers' comp companies, your general liability insurances. Look at those kinds of things as employers. Talk with those insurance companies to understand what they're going to cover and what they're not going to cover. See what policies they have or they recommend that you implement. So again, you want to gather as much information as possible from various resources, so that again you're in a good position to make the best decisions you can at that given time.
And something that's exactly what we need to all do, no matter how large or small your company is in particular, or how large or small your workforce is. It brings to mind something that you just said that I wonder about when we go back to the concept of discrimination, because we're now seeing the advent of health passes, particularly in the travel industry. It's very prevalent with large airline organizations testing out new apps internationally, here in the United States, that we would be able to demonstrate our vaccine as well as our COVID test results, and therefore we could pass into another country, as an example, or flying on the airlines, which we can do quite fluently right now. Mm-hmm. We're beginning to see this new technology, this new industry expand, because we've always had vaccines when we travel to certain countries, if you're from one country to the next. But now it's quite different and much more expansive. Do you see, or have you heard through SHRM, your industry organization and trade, professional organization and trades, whether or not this vaccine, this health pass is going to be the new determinant of some level of discrimination? So it's consumer enter at your own risk versus employer or business provide a safe environment. It's really back on the consumer, enter at your own risk. Mm-hmm. And then therefore you assume the liability because you have entered at your own risk. Mm-hmm. That's one situation. Do you see any trending in the dialogue in the think tanks and the human resource environment around those kind of considerations?
I haven't heard so much or seen much in the research yet as it relates to health passes, but what I have seen is discussions and articles around the possibility of having a card, that shows that you have had your vaccines and you have to show it to travel. I think that that's potentially something that's going to come up. I also, just returned from taking care of my mom in Mississippi. And after I booked my flight to return home, I received an alert from the airline saying, before you come back to Maryland, you have to get a test, a COVID test, and bring it with you to the airport, to fly back, or you have to quarantine when you get back to Maryland for 10 days. And so I got that alert like every day with a link saying, do you need to change your flight? It was really interesting.
Oh, wow.
And I was like, am I going to be able to go home?
No, you know what?
Home. I need to go home.
But do you know, Deborah, in the airports now, you can get a test, and tests range in prices depending on where you are in the country. If you don't have that to provide your airline, there are rapid tests that a consumer can pay between $75 and $200 for an instant test to be able to take up to that desk so that they can fly out.
Right. Well, I had a rapid test because my mom lives in an assisted living environment. So I was getting tested every day I went to see her. So I just asked them to give me a copy of the results on the last day before I traveled. But the thing about it is they were requesting a different kind of test. The alert that I received was for what's called the PDR test. And that's a test where they swab you and you have to send it off to a lab. And it's 72 hours to get the results.
Wow.
Yeah.
Well,
so it's important to know that when you're traveling, to find out too what your state regulations are around being able to get back to where you need to go, whether you're doing business travel or personal travel. So that's another, I think, best practice we need to think about. I also wanted to mention, as far as best practices, involve employees in the conversation in terms of what you need to do around the whole COVID topic, because we've been doing some employee pulse surveys for clients and asking employees their perspectives and opinions about different things, and they have some really good insight and some good recommendations. So I think it's really good to do that. I also see that mental health support and employee assistance programs are on the rise, because employees, people in general, are just having a really tough time with social isolation, with homeschooling children, with everybody being at home, with all the Zoom meetings or Microsoft Teams meetings or whatever, go to meetings, etc. And so there's a whole lot of stress and anxiety and worry that people are experiencing. So employers, we're seeing trends where employers are starting to implement greater budgets to support their workforce, because if employees are distracted by all of these things, how can they be productive?
Wow. Well, Deborah, can you quickly tell us how people can reach you? Your company is the IT. So how in the world, what is your website? And then we will bring you back on later in the year. But what is your website and how can people contact you before we sign off here?
All right. So my website is www.hrnew.com. That's our home website. HR New is a full service human resource management firm. We also have a website, hrnewtoolbox.com. We just launched a new digital knowledge asset management toolbox for employers that allow you to centralize your documents, your projects, and it's in a bank grade secured area. So,
all right, we will be in touch with you on that. hrnew.com. Thank you, Deborah.
You're welcome.
Many thanks.
My pleasure.
Thank you.
All right, guys. Thank you, Deborah. Always a good conversation. I wanted to add something, but we're out of time, and so we need to transition to set up for the press conference. But look forward to having you back on the show.
All right,
Deborah.
Thank you. Bye-bye.
This is the Marketplace segment number 1, health and wellness. We're going to transition to segment number 2 on business, the economy, on public policy, where we have a special broadcast, special coverage of the case press conference launch announcement, which is coming up next. We'll talk on the other side.
Thank you.
a small local business and you have not yet applied for your PPP forgiveness loan, you should know the deadline is fast approaching, and you need to apply now before May 31st, 2021. To apply now, go to www.untitled.com